Hi, I'm Chris Urquhart, publisher of Natural Awakenings magazine, and I'm here today with Wendy Canuel. She is from the Melbourne Chiropractic Spine and Injury Center and has over 18 years of experience as a health educator and manager of the practice with her husband, Dr. Stephen Canuel, who handles the patient care. Thank you for joining us, Wendy. We're happy to have you.
Thank you for having me.
So you offer chiropractic services at your practice, but you're also specializing in peripheral neuropathy relief, which is a little bit of a mouthful. Hopefully I said that right. Can you
Yes.
share with us a little bit how that works and what you're finding and how you're helping people with that?
Yes. So in our practice, one of the things that we have found is we are seeing a lot of patients that have peripheral neuropathy. So being in practice for as long as we have, um, our doctor, Dr. Canuel, when he decides that he wants to bring a program into our practice, what he'll do is he'll go and he will research and find the best program that is available, and then he's going to do the research and due diligence to make sure that that program is something that he wants to bring into it based on the quality and so forth of that program. So he does his due diligence to that, and when we find a program like that, which we have done with our blueprint program, then he goes typically out and he'll get the education, support, resources, and so forth that he feels he may need to back up the treatment part of that, both in education and then the resources, of course, to support the treatment itself, if that makes sense.
Right, right. So you have a specific program that you're using now, right? How
Yes.
does that? So do they come into your office and are there, with chiropractics, they're hands-on? Are these hands-on treatments or how exactly do you treat neuropathy?
Okay, so peripheral neuropathy, basically there's a couple of different types that we see in our office. One of them does do a lot with a diabetic condition. The other one is also related to someone maybe who has had chemo because of cancer. And with that, they develop peripheral neuropathy. Most of what we've seen in our office that we're treating is in someone's feet, but you can obtain peripheral neuropathy as well in your hands.
Just as a
Um,
guide, in case someone doesn't know the term neuropathy, it's
mhm.
like a numbing or tingling or in the extremities. Is that accurate?
It is, and it's interesting because with our patients, what we have found, or what I have found, is that they go one of two ways. We have some patients that come in and they don't experience any feeling at all. They're just there. There's nothing there.
Hmm.
And then we have the other patient that's 180 degrees where they feel pain and like pins and needles and so forth that are sticking into their feet, and sometimes up their legs, all the time. Like it's nonstop.
So is that like a result of inflamed nerves or?
Um, Actually, it's basically it deals with the nerves, and in layman's terms, in very layman's terms, they're basically dying off.
Mhm. Okay.
Is basically what that is. Another condition that we see typically a lot of times with the diabetic part of it is they lose the blood flow that travels down to their feet,
Mhm.
and that also is an additional issue with persons with peripheral neuropathy.
So you're having success bringing that feeling back and uh,
Yes,
and
yes, we are.
it involves
Um,
sessions or?
mhm. So we have a protocol in our office, and it does it's a twofold program and protocol. 90% of the treatment that we have of our program is done in the patient's home. Um, so it's something that they do. 90% of it is done at home, and then we do have a smaller portion of it where the patient can come in, and we're a chiropractic office, so you're going to get adjusted. And then there's a couple of other things that we do, treatments in the office as well, in combination with that visit. And the combination of the two of those works really well, and we've gotten some really, really good results with that.
That's very exciting. So people are finding a reduction in pain and maybe some return of feeling
Yes,
in their feet.
and that blood flow is also returning as well. We had one patient, Mr. Jim, and that's how you like to refer to him. He's been a diabetic for probably quite some time, but he's experienced peripheral neuropathy for about 7 years. And I'm a little disappointed that I wasn't involved in a lot of his treatment as the assistant in the office. Earlier on, I kind of took over when one of our staff was out. And so when speaking with him one day, I was helping him with his treatment, and he says to me, he's like, wow, he's like, I can't believe how much the colors come back into my legs and in my feet. And I'm looking at them, and they're this dark reddish color. And I'm like, really? He's like, yeah. He's like, they used to be like almost black.
Ooh.
And I was like, oh my.
Yeah.
I'm like, I wish I could have gotten pictures, from when he came in as a comparison. So we spoke a little bit, and he did give me the opportunity to take some pictures, and we tracked that, for the next couple of weeks or so. And it was really, really neat to see the color resume and come back into his feet. Now he's got a ways to go yet because he's had this for quite some time, but it was really, really amazing. And then he also regained some of his feeling, and he's like, Miss Wendy, he's like, I haven't experienced that in 7 years. So he was really, really excited, and we were excited because of the ability to be able to help him. Unfortunately, there's not a lot available out there for peripheral neuropathy. A lot of times, I think what most people are doing right now is they're taking medication, which is necessary. However, a lot of it is just sit and wait. So with this new program that we do have available, it's really neat because we're able to get people's lives back, at least to some degree.
Yes, which obviously in the healthcare business, you're there to help people, and it's
Yes.
quality of life, and, wellness, and staying healthy, and all of that. You mentioned just briefly that if they come in for neuropathy, they would still get a chiropractic adjustment.
Yes.
But there's a connection between an alignment and the flow and the fluid in your spinal column and your nervous, all of that stuff, and helping the body heal. Is that? I assume that's why it's integrated. Can you elaborate on that?
That is accurate. It's mainly with the nerves, though, and the nervous system. It has a lot more to do with that. Your lumbar spine is where the nerves exit, and obviously they go down into your legs and your feet. And so the adjustment there just kind of helps things flow. If you think about it like a highway, and when the traffic is flowing well, that nervous system travels, those messages travel equally as fluent. And when there's an accident, or the roads are blocked because of cars and so forth, those cars can't get through. It kind of works the same way with your nerves. When there's a blockage or a slight misalignment, a lot of times there's an aggravation that can happen on the nerves and so forth, and it can slow the messaging, if you will, down of that reception of the message and the flow of that. So the alignment basically, or the adjustment, just helps to kind of keep everything in line, clears the accident away, so to speak, and then lets things flow evenly and smoothly.
Supports the healing. That makes sense. So there's more emphasis on telemedicine right now because people are staying home and we're social distancing and all of that.
Yes.
But it's not new to you. That's something that you had kind of already incorporated a little bit, and you're seeing that maybe you can take it even further.
Yes, that is accurate. So with our program that we have, especially now, what we've been able to do is to take our we've been able to take our seminars, if you will, and kind of basically just convert them into a webinar. We had already had the ability to use technology in our practice. Dr. Canuel is a very busy person. And so with that, we had to be really smart with our time. So the education part of it, and of both what neuropathy, peripheral neuropathy is, some of the techniques and so forth that we use in our practice. So we've put that together in a webinar, and we use a program and so forth to do all of that. And then so the patients would come in and we introduce the practice, they get to see the practice, we introduce all of that, take them into our conference room, kind of give them a little overview of who we are, what we're doing, and then they would sit through, via technology, they would sit through the webinar or the seminar, which is now converted into a webinar, which now people can view from their home.
That's fantastic. So when we all come back into the light, out of our homes, you also
Right.
have the seminars in your office several times a week, right?
Yes, we do. We do.
If they prefer to come and see you when that's active again, that's an option too, correct?
Yes, it is.
So,
Absolutely.
as someone who was poised in their business to be able to easily convert to technology, you found a way to easily adapt and change, with everyone staying
Yes.
home and still being able to reach the people that need help and support them. Do you have any ideas or tips on what everyone else can be doing to be sure we're all helping each other, in this community?
Absolutely. One of the things that we were very fortunate that we kind of already had the technology part introduced. So when all of this happened, we just kind of had to add a couple more pieces here and there to go telemedicine. So we had to find a platform in which doc could use for exercises and things like that, which we do have and we're able to implement now. So that's one thing. So it was a little bit easier to transition. So what I would like to kind of just kind of put out there is, if you're in a business, maybe use this time for a couple of different things. Kind of look for ways that when you're ready to reopen, that it's something, use that time to study, use that time to find different things that you could either advance in or add to your business. And kind of get your education and your training done now while there's downtime. So that's one thing that you could do during this time, so that when you're ready, when opening day comes, you'll be ready to go. And the other thing is, maybe look for some ways where you can provide for the community. I do know that some of the restaurants, the local restaurants in there, the grocery stores, Walmart and so forth, they're limited as far as how much they can help in regards to food and things. So some of the restaurants are actually ordering in different foods, maybe steaks or fruits and vegetables, and they're actually retailing those out, if you will, to the public, kind of to help the grocery stores and so forth, because there are limited supply. But they do have those connections and that access that they can do. Maybe put together a blog or Facebook page or something within your specialty. Write an electronic book that you might be able to put together and sell to help someone within your field of practice. Those might be some other ways that you can help. Maybe create a support group, with that type of field that you're involved with. Those are just some things that, you can stay focused in a positive way during this time of crisis.
I think those are all really great ideas, and we feel like it's more important now even than ever, to try and stay connected in this way, just like we're doing today,
Sure.
virtually from our own spaces, connect and try and share some information and keep our local community connected and able and recognizing that our health professionals and other businesses that we need on a regular basis are there, still working, still there to help
Right.
us and keep our community going and feeling supported. So I agree. I think that's fabulous. Wendy, thank you so much for talking to us today and sharing a little bit about what you guys have going on there. I think, the neuropathy isn't something that, unless you're experiencing it, we hear a whole lot about. So it's nice for people to realize that we have a local resource, that it has treatment options available beyond medication. So I really appreciate your information.
Well, we appreciate you, and thank you very much for having me today. I appreciate that.
So if you're looking to connect with Dr. Stephen Canuel and Wendy Canuel at the Melbourne Chiropractic Spine and Injury Center, they're located at 490 Center Lake Drive, Northeast, Suite 108 in Palm Bay. So to learn more online, check out westmelbournechiropractor.com, and you can reach them by giving them a call at 321-499-4608. Again, thanks a bunch, Wendy, and everyone else. Be well and stay connected.
Thank you.